मेरा नाम आरजे गिनी है और मैं रोज सुबह 7 से 11 आपके साथ आती हूँ रेडियो सिटी 91.1 पर और आज मेरे साथ एक बहुत स्पेशल गेस्ट है. गुड मॉर्निंग सर, व्हाई डोंट यू इंट्रोड्यूस योरसेल्फ?
Hi Ginnie, it's nice to be interacting with you.
Thank you,
Well,
sir.
I am Lieutenant General Vimal Arora. I'm a dentist.
Yes, sir.
You know, I have been running the Armed Forces Dental Services as the Director General Dental Services for about 38 years.
Wow.
And then I superannuated and then I joined Clove Dental. And now I am heading Clove Dental as the Chief Clinical Officer. And I'm managing 341 clinics across the country. And we are providing all kinds of treatments, and especially so, right from very basic treatments to highly specialized treatments.
Sir, this is lovely. And you're also the only person who's received a presidential award almost 4 times over.
Yes, Ginny, I have been very fortunate to have been recognized in the armed forces for whatever I did, that I have been a recipient of presidential award 4 times in India. I received my Vishesh Seva medal, then I received Vishesh Seva medal in Bar, then Ati Vishesh Seva medal, and then Param Vishesh Seva medal. And I was also very fortunate that when I was in Oman, I received the presidential award from the Sultan of Oman, that is Mr. Qaboos, who was the president, Sultan of Oman at that time in 1986. So God has been very kind. Thank you so much, Ginny.
Sir, you have to be the most person I have ever interviewed. I am almost like shivering with nervousness now. So be kind to me today. This is fantastic. So proud of you, sir. Sir, coming back to Clove Dental, coming back to dental health, across we've seen that, when we've been talking about dental health, even on radio, almost 9 out of 10 people have some form of a disorder there, but it's very deprioritized. Why is that? And how is that changing? Have you seen that changing? Or is there certainly a certain percentage of people with whom it's changing, but not changing for the masses? Give us detail.
Yes, Ginny, I fully agree with you. And I think we are to be blamed for this. You see, over a period of time, probably the way the cardiac people or the ophthalmic people or the other sciences, human sciences, could bring that awareness amongst the population. Probably the dentists could not bring that kind of awareness. And what was lacking is that, because we didn't probably have even an oral health policy with the government of India until about a couple of years back. So the focus on the oral health wasn't really there. And people have no awareness about teeth or their diseases. They feel there are many teeth. Even if I lose one, so what? There are plenty of others. But they didn't realize that losing a tooth means a loss of bone, loss of function, loss of looks, loss of confidence, loss of self-prestige, and a huge loss in your overall health. Oral health directly affects your overall health is not that well understood by population as yet. And we are working towards it. For the past 5 years, while I have been in Clove, all our awareness campaigns have been focused that how you can maintain a better health and how can you make sure that your teeth last you a long lifetime.
I think that's lovely, sir. I like how you take the initiative on yourself, because it is true that whenever you go to a dentist, it's seen more as a lot of people believe it's a more cosmetic procedure as opposed to really a medical problem that you should go for. And that's why even if you look at dental checkups, they're done once in 3 years, or only when you have a toothache, which is beyond a certain pain. That's when you go to a dentist. You don't take it seriously enough. So I completely buy with that. I hope everybody who's listening realizes this. So there's another myth, or I don't know if it's reality or myth, that dental treatments are extremely expensive.
So, Ginny, I will like to add one more small point there. You see, people are going for dental treatment when they get pain.
Yes.
Which is a need-based treatment.
Yes.
They are not following a preventive scenario.
Yes.
But those who take up it as a preventive checkups periodically, once a year or twice a year, they don't get into dental problems of the kind which otherwise one lands into. Now, this particular thinking of what people say that dental treatment is expensive, I agree to it and I don't agree to it. Why I agree to it is, see, if you want to get the best of the sterilization, best of asepsis, best of disinfections, that means absolutely aseptic surgical environment. If you want the best of the filling materials and best of the restorative materials, that means no duplication, then you have to pay for it. And you should pay for it. You should never go to a dentist who is cheap, because he cannot be cheap unless he is cutting corners from somewhere.
Unless he's compromising.
Now, when you are coming to the whether dental treatment is expensive or not, let me take it up in two ways. One, if you would have been following a preventive aspect, and if you had slight sensitivity and you visited a dentist and he did a filling, you're done. In less than 1,000 rupees, your treatment is over. However, if you delay and you land up with him when you land up with very severe pain, then you end up getting a root canal done and you get a crown over it to protect the root canal. But even then, I will say it's not all that expensive. Okay. Really speaking, I don't think dental treatment is expensive, because one must spend towards his health and you must get the best possible treatment, not the cheapest treatment.
I think it has an health is all that matters. I think that's very important. So is dental right now, because of course COVID's happened, today the vaccinations are out, all of that. But is it really safe for all age groups to go to a clinic? Because till now I hear a lot of people say, "Abhi nahi jate," because you've got exposure and this is a disease that's being communicated through your mouth, through your nose. Let's not go. So what do you have to say about that?
Yeah, I have previously also come on your channel once, and I have said that probably it is safer to go to a dental clinic who is following the protocols than going and buying vegetable from a vegetable shop which is crowded. And I really mean it. Because when you observe precautions in a clinic, and when you are sure that your dentist is undertaking all the protocols for your safety, then you are very sure, because the only mouth which is open there is your mouth. If the COVID virus spread is through contact and through aerosols, then the only mouth which is open is your mouth. The dentist's mouth is covered with 2 or 3 screens. Yes. The dental assistant's mouth is covered with 2 screens. Aerosol suction devices are already on. Dentist is more at risk as compared to the patient. So I will not say that patient is at a greater risk. However, I do say that all dentists who are taking precautions in their clinics and who are observing the necessary protocols towards safeguarding their patients towards this virus, those clinics are 100% safe. One can go there without any doubts.
Sir, how do you know the clinic is safe? Like, for example, if I want to go to a clinic, so say a Clove says that we are 10x safety. Another clinic says we are 5x. Or how do I know? What is this 10x safety? Or how do I know that if it's safe?
So like 10x safety is nothing but a kind of a checklist.
Okay.
Let me take you 2 minutes to explain to you what is this checklist about. Like if you see an aircraft pilot starting an aircraft, so he does go through all the checklists, checking this, checking this, checking this, checking this before he takes off.
True.
Similarly, 10x means that it's a checklist that where at least 10 different items are going to be checked in the clinic before we undertake a treatment.
Okay.
How does that make a patient safe, or how does that make a doctor safe? Let's talk about this. So when a patient has to come, the 10x starts before the patient walks into you. That means you conduct an e-consult and you make sure that what is it that the patient is coming for? Are we ready for it? Do we need him to come to the clinic or not? That means you are carrying out a triage with the patient, and then when the patient comes to you, you take his first travel history, complete medical history, and then you see that patient's temperature, you record the patient's oxygen concentration, and you provide him with a complete PPE kit, including gloves. Now, patient's complete history is with you. You know that by and large, whatever he has told you, he is safe. You know that I have given him gloves, so even if he has touched anywhere, he is going to be safe in my clinic. He is not touching anything. He's got his PPE, so whatever clothes he has worn are safe for me. Moment he sits in the chair, next thing we do is we ask the patient to go through a povidone iodine mouthwash, which makes sure that the immediate bactericidal action, that is killing the bacteria or the virus action in his mouth, is carried down by that medicine. So patient now is sitting in the chair and he is completely safe for us. Now come to the premises. What does the doctor can do in the premises so that it is safe? He can put aerosol suction and disinfection units so that you know that it is sucking out all the air and it is constantly disinfecting. I'm not talking about vacuum suctions. I'm talking about ASDUs. Then we must have in the clinic CFDs, that is continuous fumigation devices, which is constantly fumigating the surgery to make sure that your surgery is clean. Then you can ask the doctor, that are you also having other ways of sterilization and asepsis? That is, we talk about UV light sterilization and also formalin chamber sterilization. If the doctor is doing all this, then we look at that, how is he cleaning his surgery? Are all the touch points being cleaned before you sit in the chair? Has a chair is thoroughly scrubbed before you sit? So can you tell the doctor that I would like to watch how you prepare the surgery for me? And if they are preparing the surgery well for you, that means that environment or the premises is clean along with all these things. Then we talk about the instrument sterilization. We follow a 4-step trademark sterilization for our equipment, which makes sure that every single equipment goes through a sterilization and then it is pouched. And that instrument is opened in front of the patient from a pouch, and that pouch and the instrument are discarded. It goes through a complete 4-step sterilization back. So if you know that the premises is following all this, then you ask, can you also tell me what kind of radiation safety measures you are taking? Now, as a dentist, we carry a dosimeter on our chest, that what is the radiation which the patient is getting exposed in our surgeries. That radiation dosimeter has to be sent every month back to the AERB, that is the Atomic Energy Research Board, which tests and tell you that your clinic is free from radiation, or in a way that means that your radiation is within the permissible limits. So now you know that premises have been taken care of. Then we talk about the doctor. The doctor also goes through the same checkpoints: temperature, PPE, SpO2 checkups, as well as his travel history every day. He logs it in the register that what is his temperature today. Then we talk about the process. Do you have a process by which somebody else is auditing these clinics? Are we having your records safe digitally? That pre-operative and post-operative records have been taken, and are they safe? And then lastly, is your waste management disposal being observed absolutely as per Government of India? So in a way, this is the 10x protocol. So you miss nothing. That's the beauty of this. And if you have heard even, my friends, if you have heard even, the headings of this, and if you ask your dentist even 3 or 4 or 5 points that, doctor, are you doing this? And if your doctor says, yes, I will show you, then you are happy about it. If you ask him, are you autoclaving your equipment in a B class autoclave, B for Bombay? He says yes, then you know that he is using a vacuum autoclave and no viruses in your equipment will be there. Because otherwise, if he is not using the right kind of autoclave, then probably that's not the right solution.
You could have a problem. No, thank you so much for bringing about the point so you know what to ask. I think the bigger problem is that as consumers, we don't know what to ask. Now that you brought in all of these points, I'll at least know that these are the 4 points also if I want to check. I can ask and then he has a relative answer or not. Otherwise,
Yes.
I'm absolutely at the loss.
I'll request, Ginnie, through you, I'll request all viewers, ask these leading questions when you go to a clinic.
Absolutely. We'll do
You
that.
must. And your doctor will be very happy and proud to show you.
I think that's lovely. So what oral health hygiene tips should we have while we're sitting at home to protect our entire mouth, our entire dental space, so to speak? Health tips.
So, a very conventional thought, brushing twice a day, and why should I have a dental problems? When you go to, like many patients, when they have come to me, they have told me, I brush twice a day, doc, why do I have cavity? I'm brushing every day very religiously, why am I having a tooth loss? So the thing is that brushing twice a day is not enough.
Okay.
Things have changed over a period of time. Our diet has changed, which has become much more sticky diet, sweeter diet, and fibrous diet. The chewing habits have changed. The jaw sizes have changed.
Okay.
The teeth are undergoing much more stress because a person is in stress. So even kids are grinding their teeth while in sleep. Grinding your teeth takes away huge amount of the tooth structure, which changes the contact points of the tooth. That means you will have greater food lodgement. So if I have to tell you today about the tips on oral health, I will say that if we are living in this world today, with these kind of stresses, this kind of change of diet, and this kind of bite, I will suggest that we have to do more than brushing twice. I'll say that please pick up a soft brush. So start with the brush, pick up a soft brush. Pick up a toothpaste which you feel happy about it and change your toothpaste. Definitely. And use a very small quantity of toothpaste. Will you take a fluoridated toothpaste or will you take a medicinal toothpaste will also depend on what kind of advice has been given to you by the dentist. You must use now the interdental brushes and dental flosses. These are the adjuncts which were never talked about earlier. Earlier only it was just brushing, but now we say, can you use floss? Floss is very easy to use if you have been demonstrated by the dentist properly. Interdental brush is a very small aid which everyone who gets food lodgement in his teeth must learn how to use that. Once you have come to this level, then I say that for your gums, can we do finger massaging of your gums? Not dry, but lubricate your finger a little bit and do gentle massaging of your gums so that if they are having any congestion, that can be released. Then rinse after every meal. That old habit when we saw our, grandfather or, our grandmothers gargling to glory, that whole house used to wake up, that somebody is brushing. Probably that wasn't all that bad scenario. And during COVID time, everyone has learned how to gargle. Yeah. So rinsing of your mouth, gargling of your mouth and the throat thoroughly brings your oral cavity microflora or the bacterial culture down to negligible levels. And that is what I will say that the oral health tips will be for this generation and going forward. Then another thing I would like to add is that, povidone iodine has been considered as a good bactericidal mouthwash. It kills all the virus. But as per now, the latest research in US and in all other advanced countries, CPC, the cetyl pyridinium chloride is now the next new agent, which is very powerful against the coronavirus. And whatever mouthwashes contain CPC will be the best for you to use. I don't want to take any commercial names, otherwise I'll be branded. But when you're buying a mouthwash, You see, does it contain CPC? And you will be safe. So a mouthwash which contains CPC will be definitely the best. Povidone, iodine, or hexidine. These three agents definitely bring down the oral microflora to a very acceptable level. So these are also the adjuncts in addition to brushing, flossing, interdental brushing, and the mouthwashes.
And this is lovely, sir. But thank you, sir. It's been a real pleasure talking to you.
Oh, thank you so much. Jai Hind.
Radio City.